Have you been hearing about Ultherapy and wondering if it's actually worth it for tightening and lifting your skin? Maybe you've seen it advertised as a non-surgical facelift and you're just not sure what's real, what's hype. Let's break it down today. Hi, my name is Dr. Morgana Colombo. I'm a board-certified dermatologist in Northern Virginia and founder of Vida Derma, a science-backed skincare line aimed to help women as they age. Ultherapy is a brand name for a treatment that uses something called micro-focused ultrasound with visualization, or MFUV. It's the only device of its kind that is FDA cleared for non-invasive lifting of the skin of the brow, face, and neck, and for improving lines and wrinkles on the chest, also known as the décolleté. It's been around since 2009, and there's a solid body of clinical research behind it. So how does Ultherapy actually work? The device sends focused ultrasound energy deep into your skin, reaching layers that other non-invasive treatments can't easily get to. It hits tissue at very precise depths, including a layer called the SMAS, which is the same deep tissue layer that surgeons target during a traditional facelift. The heat creates tiny zones of controlled thermal injury, and your body responds by producing new collagen and elastin over the following months. That's what gives you the gradual tightening and lifting effect. Now, let's talk about the pros. The biggest advantage to Ultherapy is that it's completely non-invasive. There are no incisions, no needles, no general anesthesia. You walk in, get treated, and walk out. You may be pink for like 30 minutes. That's it. Most people can go right back to their normal activities the same day. That's a huge draw for people who want some improvement but aren't ready for surgery, or just busy people that don't have time for downtime sort of procedures. The results are backed by real clinical data. A large systematic review found that about 77% of patients showed improvement at 90 days, and about 69% still showed improvement at 180 days. Patient satisfaction rates are consistently high, with roughly 71 to 78% of patients reporting they were satisfied or very satisfied with their results. In my experience, the patients who do best are the ones who have realistic expectations going in. And Ultherapy is great for people in their 40s and 50s that are already looking good and just want a little tightening. Another major pro of Ultherapy is that it works on all skin types. Unlike some laser treatments that carry a higher risk of discoloration in darker skin tones, ultrasound energy is chromophore independent. That means it doesn't target pigment, so it's generally considered safe across the full range of Fitzpatrick skin types, all skin types, guys. The results also look natural. Because the improvement happens gradually over 2 to 6 months as your body builds new collagen, you don't get that sudden, obvious change. People around you just notice you look refreshed. Ultherapy can also be combined with other treatments. Many clinicians pair Ultherapy with fillers, neurotoxins like Botox, or even radiofrequency treatments to create a more comprehensive rejuvenation plan. Now, let's get into the cons, because no treatment is perfect. The most common complaint when it comes to Ultherapy is pain during the procedure. There's a new device, Ultherapy Prime, where pain is minimal, by the way. Studies report an average pain score of about 3 to 4 out of 10, but some patients find it significantly more uncomfortable than that, especially along the jawline and forehead. There are comfort measures available, including topical numbing creams and oral medications, but it's important to know that you will feel something during the treatment. Like I mentioned, the new machine tends to be less painful, but even the old one is tolerable, guys. The results with Ultherapy are moderate, not dramatic. If you're expecting a surgical facelift result, you will be disappointed. Clinical measurements show brow lifts of less than 2 millimeters and modest reductions in submental fullness. This is a treatment for mild to moderate skin laxity, not for significant sagging. Patients with excessive laxity or BMI of over 30 tend to see less benefit. So I love it for females 40s, early 50s that just need a little pick-me-up. The effects are also temporary. While improvements can continue building for up to a year, the aging process doesn't stop. Most patients need maintenance treatments, and the optimal interval depends on your age and the degree of laxity. There is limited long-term follow-up data beyond 1 year in the published literature. I recommend yearly retreatments for my patients to just maintain results. Side effects are generally mild and temporary, things like redness, swelling, and occasional bruising that resolve within days. However, rare but more serious complications have been reported. These include temporary nerve weakness causing lip or brow drooping, numbness, in very uncommon cases, subcutaneous fat loss or skin injury, but it's really not common. I personally have not even seen any of that. A systematic review of adverse event reports found that lipoatrophy and neurologic effects, while infrequent, were among the more notable concerns reported to the FDA's device database. Cost is another consideration, guys. Ultherapy is not covered by insurance, and a full face and neck treatment can run anywhere from $2,000 to $5,000 per session. When you factor in that results are temporary and maintenance sessions are recommended, the cumulative costs add up over time. One study found that patients spent an average of $7,000 on various non-surgical treatments before eventually pursuing a surgical facelift, and they reported that surgery provided a greater rejuvenation effect. But, let me tell you, surgery is very expensive these days. It's going from, like, in my area, 20 to 50,000, sometimes even 70,000. Finally, results can be inconsistent. Not everyone responds the same way to Ultherapy. Factors like your age, skin quality, degree of laxity, and even the technique used by your provider all influence the outcome. Choosing an experienced, board-certified provider who customizes the treatments to your anatomy is critical. Like I always say, things have to be customized for better results. So here is the bottom line. Ultherapy is a safe, FDA-cleared option for people with mild to moderate skin laxity who want non-invasive improvement. It works best as part of a broader anti-aging strategy, not as a standalone replacement for surgery. The key is having realistic expectations and working with a qualified provider who can help you decide if it's the right fit for your goals. If you're noticing early signs of sagging or you want to maintain results from a previous procedure, it's worth having a conversation with a dermatologist or cosmetic specialist. Every person's skin is different, and the best treatment plan is the one tailored for you. And then just as a conclusion here, I personally love Ultherapy. I've been getting it done on myself for the last 5 years. I think it's really helped my jawline stay tight. It gives you a little lift effect on the lower face. Love the fact that it's non-invasive. I highly recommend to perimenopausal women in their 40s that have a good collagen amount but are losing collagen as they go through perimenopause. It's a great collagen amplifier. Doesn't work as well for people that just have lost a lot of collagen, as I mentioned before. So if you found this content interesting or if you have any questions, please ask below. If you want more videos like this, please don't forget to like and subscribe, and I will see you in the next video.